Hello, all. Lovely to have you here this afternoon. We're very excited about this session, such an important initiative. Let's just start. I'm Mandy Charman. I'm the manager of the Outcome Practice and Evidence Network, and I'm here to host this session today. Before we go forward, let's just acknowledge the traditional owners of the land we are each on today. For me, I'm on the Wurundjeri lands in the lovely Macedon Ranges. I'd also like to acknowledge elders past, present and future, along with any Aboriginal people in the audience. I also acknowledge the culture, traditions and wisdom of our Aboriginal colleagues and families we walk alongside. I acknowledge that sovereignty was never ceded, and this always was and always will be Aboriginal land. Thank you so much for making the time today. I know our COVID workload always escalates and it's hard to squeeze these sessions in, but they're highly valuable and we really appreciate it here at Open. First, we'll have a little bit of housekeeping. If you can please mute yourself. Can you ensure your Zoom name is your own? We are going to be recording this, so be aware of that, but it would be lovely if some people could leave their videos on. It's always much nicer for our presenters. And I think Jane and Stephen are very keen for person-to-person interaction. If that's the way you're inclined, I think they'd really welcome actually directly talking with some of you in our discussion session. The session will run for an hour. We'll have about a 35-minute or 25-minute presentation and then some time for questions and discussions. Feel free to put your put questions in the chat as they occur to you, because often if we wait to the end, we've forgotten. I can then pose them to Stephen, or if you wanted to, you could put your hand up or notify me that you'd like to discuss directly with Stephen and Jane, which I'm sure would be lovely for them. If you have trouble with your technology, often if you leave and come back, that sorts it out. Otherwise, Sarah Ryan, who I can actually see her sitting next to me in this room, is a tech whiz and she'll be able to help you. Is there anything else? Technical issues. I think that's about it. Make sure your names are your own so that then we'll know who we're actually talking to. Sometimes we end up with our children's silly names on their Zoom account. Okay, welcome today. At today's session, we'll be learning more about an important initiative for progressing our evidence strengthening and learning journey. As you're aware, the Open's role is to work within the child, youth and family service sector, bringing together services, policymakers and researchers to use, share and build evidence. We breathe evidence, we see evidence everywhere because we want to drive and help you drive the outcomes that make a difference for children and families. I've now been in this role 2.5, 3 years, and I know that everyone I work with in the sector is equally passionate about making a difference for families and learning from what has been successful. While Open started this role in 2017 as a critical element to support the sector's evidence journey, we've all been on this journey together. So we've got 2,800 subscribers to Open, and we've got 500 organisations involved in Open. So it's a really large investment of time the whole sector is putting into this agenda. What a journey it's been. Through our work with the sector, we have found a phenomenal hunger and commitment to strengthening our evidence and learning system at whatever point in our journey we are. Open works to provide support for the sector's different evidence needs, working across the evidence spectrum. We do this through bringing people together, such as in this forum, and supporting opportunities for collaboration on important initiatives which progress our common agenda. We've a wide reach with many subscribers and lots of organisations, and we're growing all the time, which is super exciting. We run face-to-face and online events. Clearly, you're here today, bringing people together to share their work and its lessons and to foster collaborations across the sector. Today is just an example of this, as the menu provides a wonderful opportunity to collaborate. Between 2019 and 2022, we actually ran events involving almost 2,500 people. We help with technical skills related to evidence, data collection, outcome measurement through advice, project support and training. That can often be something that our event participants aren't aware of because it's something that happens behind the scenes, but we're going to be coming out really big in that space in this year with some training offerings for everyone. We've worked with almost 150 sector organisations between 2019 and 2022. We also offer an online portal which provides knowledge translation products and technical skills to enable a very busy sector to access resources. It's fabulous to be part of this journey, and while the momentum is building, there is always more to do, exploring new methods, tools and approaches, hence we're here today, to engage and collaborate and work productively with our partners. And that's what we're going to hear about now, the release of the menu, a new feature of the learning system and what it can provide the sector in understanding the existing evidence base for our work. We're excited to explore these opportunities and all those that will arise in relation to working with the department and across the sector on this with this important tool. Thank you very much. Now, I'm going to hand you over after that little spiel to Executive Director Jane Sweeney. Whoops. And Stephen Bennett is a Principal Policy Officer from the Department of Family Fairness and Housing. I'll hand over to you now. Thank you.
Thanks, Mandy. And hi, everyone. It's lovely to be here. I just want to acknowledge I'm on Wurundjeri country and pay my respects to elders past and present, and acknowledge all of the lands you're on and any Aboriginal colleagues here with us today. Mandy, it's so great to be able to talk about the menu today, and particularly at the open forum. It's such wonderful work that you and the centre lead, and just want to acknowledge the work of Deb and yourself and all the team. I think we've seen a pretty amazing journey through the evidence and data and evaluation space, and it's something that we all think is really critical in the work that we do. And I just acknowledge all of the sector colleagues online, and particularly everyone that's helped us on the journey to sort of build and develop the menu. Really, I think we've had a really strong focus in the children and families space, and particularly in that reform context in building and sharing knowledge. There really are critical enablers to achieve the system transformation that we all want to do. And I think we've seen that really strongly under the roadmap, and in particular the Aboriginal dedicated focus under Wangaroo Gap Gap Dua. And I think the partnership piece we think is really important, that we have with the sector and with key institutions that support, I think, this work. And I think it's been a lot of work over many years, and it's great to be here today to sort of take stock, but also how we sort of take this forward. And I think how we sort of think about designing and testing models of care, such as the family preservation and reunification response, and putting families first. And I think, as I mentioned, particularly the work that the centre has been able to drive with Open, it's such an amazing, when we think about the beginning of it and where it is now, and forums like this able to share, I think, critical work that's been, wherever it's being led from, whether it's sector or government or that partnership piece, it's really important. So last month, we were able to release the menu of evidence, and it's really a dynamic and robust online portal that supports evidence-informed decision-making and enables high-quality, client-centred and effective service delivery. It's a long-standing commitment under the roadmap for reform, and it's really been, I think, strongly supported and developed with the commitment of government to really try and drive that evidence capability and capacity. We're really excited to share this with you, and Stephen will talk you through how it was built and sort of how you can use it. And I think the sort of thing we're really keen to do is build on this. This is the beginning. It's an iterative menu that we hope that through the use of all of you and others, that we can really start to build it and collectively build that evidence base. I think I've said before that Open and the Centre for Excellence are really valued partners in this work, and it's really about how we lead and drive the child and family systems through that sort of reform context. And I think one of the things we're really keen to do is to continue to partner across this work, but also how we can bring this work to you. And I think the way in which today is one example of showcasing this, but we're really keen how we take this forward in sessions, how you've sort of found using it, how we can build the work that you do into it. I'm not the expert on it. I've got a team of experts, and Stephen has been one of the key leaders in this work. He's going to actually talk you through how we built it and how to use it. But we're really excited and really hope that you get a lot out of it, and hope to hear back from you how we can build it bigger and better as we go forward. So thanks, Mandy. It's great to be here today, and I'll hand over to Stephen to talk you through it.
Thanks, Jane, and thank you all for taking the time out of your busy days to come and learn more about the venue. It's really kind of humbling to see the level of engagement and reception that we've had since it's been out in the last month. And as Jane mentioned, the ongoing partnership to expand and support the sector to build the menu and the evidence base is really exciting. So as I'm just going to share my screen. Let's see. The menu of evidence is an online repository. It's an online repository of what works to improve outcomes for children and families. The website is menu.dffh.vic.gov.au. So please, after the session, jump on and explore. We have a short video that just explains about what we're trying to do with this. I'll just play this now.
People working across the child and family service system do important work that can have profound effects on the lives of children and families experiencing vulnerability. Through the Roadmap for Reform, we are transforming the system to ensure this work is safe, effective, connected and person-centred to achieve the best possible experiences and outcomes for children and families. To do this, we need an evidence-informed learning system that brings together high-quality evidence of effectiveness with knowledge from lived experience, practitioner expertise, insights from research, and Aboriginal ways of knowing and doing. But information on what programs work, for which people and when, can be hard to access and difficult to interpret. The menu of evidence is designed to address this. The menu is an online repository with the latest evidence on a wide range of evidence-based practices and programs to support people making decisions about how to improve child and family outcomes. Designed for those working in the child and family service system, users can navigate programs by what matters to them, including the outcomes they are working to achieve, who they work with, and their context. The menu is underpinned by a rigorous approach to ensure that information is independent, transparent, accessible and useful. It brings together evidence of published research and emerging local programs and practices. The menu provides key information on effectiveness, implementation, cost, how it works, including for Aboriginal children and families, and considerations for policy, practice and research. This information can support evidence-informed conversations across the sector to make decisions that are safe and responsive to the needs of children and families, wherever they are on their journey. Come explore the menu for yourself.
So as the video says there, one of the challenges that when we were looking at in terms of how do we access quickly evidence about programs and practices that may be relevant for the children and families and outcomes that we're working for and working with in Victoria. So there are many repositories globally out there, and what we wanted to do was really kind of focus on the needs of the Victorian Children and Family Service System and decision makers and practitioners across the sector to really understand what is the information that matters to them and how can we present that in an accessible and usable way. So this was one of the, under the Children and Families Research Strategy, was one of the evidence system initiatives, and really complementary to other work that was being undertaken at the time, including the establishment of OPEN, the trials of evidence-based programs, and really, kind of through the development, we've built this in kind of a staged way to really, understand the needs from across the service system, to really kind of shape its evolution and development. So the menu it's an online website, and it's underpinned by two systematic reviews across, for the first version within child maltreatment, and secondly within family preservation reunification. It has 45 programs that were identified through those reviews. And what's really kind of unique was going through the systematic review process and development, is really we kind of a range and depth of understanding across those programs around the outcomes that they've been demonstrated to be effective for, information about the cohorts that they've been trialed and tested with, and also other considerations around their implementation, their delivery, their cost, and whether or not they've been evaluated, or if there's evidence for relevant cohorts and groups, including Aboriginal children and families. So within those two topic area reviews, there was a large number of research outputs and information that we've found through those. So I'll take you a little bit through the development process and show you the website. Please, pop any questions in the chat, or you can save them to the end, and really kind of happy to talk through this. We're looking to do ongoing roadshows around the first iteration of the menu, but then also in terms of where we take this next. So really, the kind of the challenge I said before is, how do we, provide access to the best available evidence, noting that decision makers and practitioners are often, it's challenging to kind of access and interpret and unpack, studies and evaluations. So we wanted to build something that's an online repository, so we can actually have something that can be easily navigated through. We're also aware that, in terms of repositories globally, one of the key, things that we needed to establish was trust in the evidence that underpins the programs. So we engaged academic experts, including the University of Monash, the University of Melbourne, the Centre for Evidence and Implementation, and the University of Adelaide to develop the technical specifications which guide the reviews, but then also to undertake those reviews. As Jane, mentioned, we really need kind of expertise in this area. And while I think it's one of the kind of reflections of going through this process is really leaning on the expertise across our academic and sector partners in terms of how best to approach this. And to do this in a way that we can be confident in the information. Through the initial early consultation on the development of the menu in 2018, we heard from the sector that we really needed to, include more than just information on effectiveness, and really the broader range of information that's required for evidence-informed decision making. So as I mentioned, we include information on implementation, cost, and evidence for different cohorts. We also heard from the sector that the evidence ratings and that we would find through assessments of the published studies, we'd need to actually kind of consider the pathway for locally developed and emerging practices and programs. So in the actual menu framework design, we have considered how best to do that, and we're looking forward to consulting through Open with the sector on how we can help you get our own programs on there, but also to build the evidence base of what's being evaluated locally as well. So that's something that really kind of keen to kind of explore more on. And lastly, it is designed as a living repository that will kind of review and expand over time. The reviews were done at a point in time, and we're aware that the evidence is always shaping and evolving, and we need to kind of think of ways to best update, with evidence that's been undertaken locally, but then also to kind of grow different practices and programs. And one of the things I will call out at the beginning in terms of the design of the menu and the pathways to build it is that we're looking, we've designed an approach to understand evidence within children and families, and evidence within the two topic areas of family preservation and reunification and child maltreatment. So the menu does not give you a full picture of the programs that have been evaluated. And what I mean by that is, for some programs that may have outcomes that are relevant to cohorts outside of children and families, or interested in juvenile justice outcomes or mental health outcomes, that they may not be included within the evidence that's on the menu. And we really kind of need to think about how we kind of build that up and complement that. So if there are programs that you found and you're interested in why that there are evaluations that aren't included there, then that might be one of the considerations. So I'll just talk about the pathways to build the local evidence base. So as I mentioned before, there's two pathways. There's the published studies and then the local evidence submissions. We're still working through how best to consult on the local submission pathway, and that's the next stage for development and implementation. And we are aware that there's a lot of interest in that. Right now, for the first iteration of the menu, we've approached how do we assess published literature. And as I mentioned before, we have technical specifications which have been designed by academic experts across the universities, which really inform a systematic review process. So what was really clear at the beginning, we did some initial consultation, was to understand what is the evidence and outcomes that we're interested in. So within the menu, there's certain levels of screening that goes into the process. So first, we're looking for therapeutic, interventions that are relevant for children and families and relevant for outcomes of interest. And there's several ways that we identify that. So the University of Adelaide team reviewed 6 academic databases and then go through a screening of whether or not they fall within that initial scope. We then assess each of the identified studies to ensure if it meets some scope, design, and quality standards. So we're looking for the scope covers therapeutic interventions for children and family and for the relevant outcomes. The design for the published study, we're looking for how they've actually evaluated effectiveness. So whether or not they've used a quasi-experimental or randomized control trial or systematic review. If they haven't met that threshold, then they're excluded from the menu. And then we also do a quality assessment, and the review team is applying risk of bias assessment tools developed by Cochrane to identify the risk in the quality of the studies. So we're really looking to include the really high quality studies that we can be confident of the information. But what's also really interesting about this process is that we keep track and records of at each stage of this review process, so we can identify why certain studies weren't identified. Another really kind of interesting thing before I go on to the assessing risk of bias and evidence is that we took a very different approach in terms of how do we identify programs and practices on the menu. Globally, other menus and repositories, they start with a list of programs and then they do reviews around those programs to find the evidence. However, we decided to start by doing a review of the evidence, and from the studies that met the scope, design, and quality standards, we then identified the programs, and then we did a subsequent review of those programs to ensure that we captured all of the evidence that sits around them. Once we've identified those, and the reason why we did that was not to kind of bias in terms of going to the most kind of evaluated programs, and really to identify if there were some other programs that might be effective that we may not normally capture in the review process. So that's kind of a really interesting kind of difference that we have there. We then assess the risk of bias once we've identified the studies and assign an evidence rating. And I'll explain more a little bit about the evidence rating towards on the next slide. And then once we've identified the programs and we have the included studies, we then create the evidence summaries. So they are the actual web pages that describe the information on the program. So the last step, which really kind of sits, in parallel to the menu, is around the implementation support for policy research and practice. So myself, Nicola, Pauline, and Maddie, we sit within kind of, working on the menu. We're looking at the, how do we drive the use of the menu and build the evidence base there, but also we're undertaking work through the primary evaluation unification response for implementation science support to deliver some of the programs that are on the menu. And that also kind of cuts across the work of open around thinking, how do we, support the agencies to use the information that's on the menu and make decisions of that. And as you see, with the arrows at the bottom, this is a continual loop, and we hope that as we implement programs and develop new programs, then we can get them onto the menu and think about that cycle to build that there. So with the evidence ratings, we've really tried to provide a consistent and transparent way to describe and assess the strength of evidence. And this is a really kind of challenging, approach in terms of actually how do you do something that's easy to understand, is consistent, and captures the information that we have within that. So we have logic informed and emerging, so they apply to the local evidence pathway, and really what these will be doing is whether or not there's a clearly articulated theory of change and logic model which kind of explains how the intended activities influence the outcomes. And then the emerging is to whether or not there's an evaluation underway of those programs, and we'll be consulting, on how to implement and support the sector to do that. But for the published studies, the supported is whether or not there's one high quality quasi-experimental study or randomized controlled trial. Well supported is 2 or more, and very well supported is 1 systematic review. We've also included a plus rating. So what the plus rating it shows is whether or not there's been an effectiveness impact sustained for more than 12 months. So when the evaluations are looking at kind of long-term effects, and that's a really kind of interesting thing in terms of how long the effects are sustained, and for kind of really kind of demonstrating what programs have shown that. Now in terms of the how we've looked at effectiveness, we haven't gone by other looking at just effect sizes or a certain p-value. Following advice from our academic partners, it was really important to take a kind of holistic and nuanced approach around a meaningful effect. So we're looking at not only at the effectiveness for an outcome, the strength of that effect, and also the considerations around its context, and what that means in practice. And so really taking more just a nuanced view than just saying it's met a certain effect size there. And one of the things, and I'd love your feedback when you're looking at the evidence summaries, is if there's more information that you want on effectiveness or on the study designs, please let us know, because we have a real wealth of information that sits behind the menu that we can put on there. But through that the development of the evidence summaries, we've really tried to ensure accessibility and clarity of the information, and really be guided by how our users are kind of looking at that information. So just to give you kind of a sense of the size of the review, and when I talk a little bit more later about the length of the journey to get on, really it has been a really rigorous academic exercise that has involved multiple steps to do. And the reason why we, after we undertook the initial search, using the search strategy that was developed, there was 60,000 records, 30,000 publications that were duplicates, and a decision was made really how to kind of eat the elephant with this, and there was a decision really to kind of focus on what we call focus areas. So these are within that literature review, the total number of studies. We've just focused on family preservation, reunification, and preventing maltreatment. So we're looking just at the programs within those two focus areas. So what we can see here is from the 60,000 records, we assessed, the review team looked at 480 studies and identified 32 programs. But that after, screening by study design and a full text review, there was for the 26 programs that were identified, there were 19 that were lower risk and that were included. So what we're really seeing is kind of a real kind of narrow reduction in the kind of number of studies there. And similarly for preventing maltreatment, there was 26 programs that were included that are on the menu right now, and 156 papers that were included at that risk of bias stage. And as it says there, really the larger number of programs are due to some of the kind of number of studies was due to the more evaluated larger models that we identified there, such as incredible years. One of the really kind of exciting things about this review process is the data extraction form. So we do extract a lot of information on the study designs, how they were evaluated, so the indicators and measures used, the cohorts of that were studied with, and really to present that information in an accessible way on the website. So when you're looking for different programs of practice, you can think about the outcomes you're interested in, the modality, the delivery method, and we can present information that shows what might be relevant to you. I think the other thing just to say in terms of how the menu is used is we're not trying to tell you what to deliver. We're trying to present information on important considerations around a program of practice and the depth of the evidence base for that. And really, to present also links to the resources so you can go away and do further research on that. So just a kind of a snapshot of the journey. I've been working on this since 2018, when we undertook the menu framework report. So we had feedback through the Learning System Practice Implementation Group, which is a RIMAG Roadmap Implementation Advisory Group subcommittee. We had sector workshops, and they really informed the need to include sector pathway, to include information on implementation costs and that, but also we heard from Aboriginal stakeholders around how do we recognise and elevate what has been evaluated for Aboriginal children and families, and how do we further recognise Aboriginal-led research in that. And so we took that feedback on board with the development of the technical specifications, and we've now undertaken the 2 focus area reviews. So today we're at the last month we're at the stage 1 release, and really we're looking to now kind of embed and inform how we're currently using the menu content. So I'm really excited to see kind of the questions that you have, and then really to kind of engage and consult through open on how do we build out the local evidence base, and how do we think about the other research and evaluation that's being led across the sector and academia to really kind of inform and make those connections there. So the ongoing consultation has been really important to the development of the menu thus far, and we're really excited to see how we can kind of work on that as well. And you'll see there we've got a phase 1 menu review. I'm really, I'm keen on getting, actually having a staged review process towards the middle of the year, which is coming up really quickly, just to gauge initial feedback from the users and yourselves in terms of the current information that we have on there, and look to making improvements. So please, if you are interested, I know Mandy is going to send around a survey after this, if you'd like to be part of that process, but please reach out if you have any questions in the meantime. And so I'll just show you the menu for those that haven't seen it. So when you look at the website, if you go on menu.dffh.vic.gov.au, we do have information on the purpose and how we've built it, and also using the information, so the guide to the summaries and the ratings. And we're going to be continually updating with more tools and resources and connections to open on the site. But when you go down to the searching the menu, you can view all the programs as a list, or you can apply filters to look by the different evidence ratings, the 2 topic areas that we have developed. We've also tagged all of the programs across the different roadmap pathways, from early help to continuing care. And we've also tagged by the different outcomes. So if you're interested in a family or parent giver outcome or cost, you can filter by that level, and also by target group in terms of age, and whether or not there's been an Australian study included there. So let me just pick a program. So we have if you're looking at functional family therapy and you click on, we've tried to present, we've done our best to kind of summarize the information on the program within the children and family area. So you're presented with an overview in terms of the evidence rating, what pathway, whether or not there's any Australian studies included, what the risk of bias was, and any cost and target cohort. We've described what the program is and what it aims to achieve. And then we've also tried to present information on the effectiveness of that. So we've tried to strike a balance between detail and brevity and accessibility. So with each program, we have an overarching description of the effectiveness and the key outcomes. But then also present a table which is the direction of effect. So for each outcome that was measured and included in the review, we note whether or not there was a positive, no effect, or negative effect found. And if there's a yes in multiple columns, then that means that there's a mixed effect within that. So what we try to do is aggregate at the outcome level, but also noting that when different tools are used to measure these outcomes, that they may find mixed effects. And we also try to tell that information if there was multiple studies, so whether or not one study found positive effects, and if there was mixed effects found over multiple studies. So this really presents information there, and I'm looking forward to your feedback on if that's an effective way to do that. We also present information on the number of studies, and we also differentiate between primary studies and research outputs. So for example, one study may have multiple research outputs, and if they're all based on the same study, we keep that information on, present it here. And that's really important if we're trying to look at kind of multiple studies that support a program. We include this statement around how evidence supports Aboriginal children and families. And this is our kind of first step in, in explaining information on whether or not studies have included Aboriginal children and families. And we do go a step further as well in terms of extracting and presenting information about where each of the studies were conducted and the sample that was included. And that's really important for thinking about the generalizability of the findings and the context in which these programs are going to be delivered. The majority of the studies that and programs that were identified are in America and the United Kingdom, and so they may be they have been tested with a different cohort and service system context, which is really important for the decision making around, is this program likely to be effective here, and how do we build up the evidence base in an Australian context. Then we also include information on the implementation and how it's delivered, and any staffing and training requirements, and then whether or not the program is available in Australia and who it's delivered by, and how much it costs from the available information. And lastly, we include information on the included and excluded studies. So please, kind of jump on and have a look at the sites, and really excited just to hear your feedback and questions around the information that we have on there, what you'd like to see, what doesn't resonate, if there's any questions you have when interpreting this information, and what other tools and resources we should be looking into to support engagement with that. I've been talking for a little while now, so hopefully there's lots of questions. But our next steps really are to consult on the submission process, and also to consider how the information is being used and how do we support engagement of that. And as Jane said at the beginning, this is the first iteration of the menu, and I'm really excited to finally have this out now, but really looking for feedback on where we take this next. Mandy?
Thank you very much. Really interesting. I've heard a bit of the detail before, but I always just the complexity and depth that you used in examining international evidence is really instructive. I just go, oh my God, that would be great. We have had a few questions. I'll just start with one that came early. It was actually answered in the chat, but I think you probably have some really good reflections as well. I noticed that the DFFH FPR practice models aren't included on the menu. They're evidence-based modules. Can you explain why they haven't been included?
So right now, we've kind of done this for the two topic areas, and the actual review for family preservation unification was undertaken prior to the development of the FPR response. The other thing so we are looking at how do we actually build out, right now we have a lot of programs, how do we actually build practices and approaches onto this, and how do we then link them to the programs that they may have been developed with, and then also how do we present the logic informed and emerging programs on there. One of the considerations we have is how are practices and approaches evaluated, and how do we include that on there. So we're working to get the family preservation unification modules on there at a later point. But again, it's how is that described? We're going to have an evidence summary for each discrete practice, or as a model as a whole. And I think that's a really kind of interesting one to look at in terms of when agencies are applying the modules differently, and how best to do that. But I am really, we are aware, in terms of when we did some initial reviews, there are the practice, there are evidence-based programs, but how do we also look at, modular, common elements approaches, and present the information in a similar way that's kind of useful for decision making in those areas. So hopefully that answers the question. It's definitely front of my mind to get that on there.
That sort of goes a little bit to the next one as well, because you're indicating how you move forward and how you'll continue to build And we've had a question about, will there be other topics featured on the menu? And if not, can programs that go beyond these 2 topics go onto the menu? And that's a question about implementation, but perhaps you might want to, and I know you haven't quite worked that out yet, but if you'd like to provide some initial thoughts.
Yeah, so when we like the vision, the very first vision with the menu is this would span the full service system continuum, and then we actually started doing the review, and thinking about how extensive this review process was and the resources that we had available. And so that's where we landed with focusing on these areas that we were aware were coming up for reform, and really think about how do we best provide that information. So that's where we landed with child maltreatment in terms of kind of early help, and then earlier intervention, and then thinking with family preservation and unification. So we're currently scoping out what another topic area or focus area could be. We may not necessarily do a systematic review approach. We had the University of Adelaide research team with 7 researchers undertaking the review over a period of 14 months. So it's quite an intensive process. So we're looking at different types of rapid syntheses that we can do. And again, in terms of new programs through the kind of submission pathways, we're not necessarily bound by those focus area reviews, but we need to kind of work through how do we approach this. So one of the things that we were aware of when we commenced the menu of evidence is that there would be a gap in terms of Aboriginal programs that have been, an evidence in those areas. So we invested in building the Aboriginal evidence-based project, so engage VACA to work with ACOs to scope an Aboriginal knowledge and practice centre, which will be complementary to the menu and open, and also to work with them around how they describe programs and practice. And I think that's what we'll be looking to do, is think about ways to support getting onto the menu. So the answer is that was why we kind of made those decisions. We are looking at further areas, and if you looking to engage researchers in undertaking systematic reviews across children and families area, I'd be really interested to know and think about how we can get that onto the menu, or kind of go in partnership with that. So yeah.
Just picking up on, I'm very interested in, and I imagine everyone is, in building the Aboriginal evidence base, and wondering, and the recognition that something might be slightly different, or need different sort of fit there. And I suppose I'm wondering about whether there's been any thoughts at this stage about whether the intensity, how the manual will manage different types of evidence, because I know that the Aboriginal space is quite a different type of evidence, and I've wondered if there's been any thoughts about that.
Yeah, so on as Jane mentioned at the beginning, the frame that we've taken with the menu is around evidence-informed practice, which is bringing together the best available evidence with practitioner expertise and client needs and preferences. And we are also aware of the range of other evidence sources through monitoring, different types of formative and summative evaluation that go into decision making. And the menu in the first version is really just looking at effectiveness studies. So we are excluding a range of evaluations that may have been conducted. And we really need to think of that broader evidence ecosystem and the pathways to build that evidence there. In our initial thinking around the logic informed approaches, that's where we kind of take that broader different types of evidence and thinking and knowledge and practice around how have we made decisions about a program and how it intends to work with that. And I think that's where we'll be kind of looking to kind of explore how do we build that evidence base there. and one of the things I just wanted to say is, this is just trying to describe the evidence for the programs. It is not trying to, tell you to, kind of, we're only going to deliver well-supported programs. A locally developed theory of change that's informed by client needs and Aboriginal knowledge, and other emerging research and evidence in a Victorian service system context, may, be stronger, compelling case in terms of how do we, what to deliver. Because one of the things that we're seeing, through the menu reviews, is, a lot of the evidence, is in an international context. It hasn't been evaluated for outcomes that may be relevant to our service system. It does not include cohorts that are relevant to our service system. So we, for us, kind of, thinking about what may be appropriate to deliver, it presents that information to you in terms of what considerations do I need to take in to think about there. And, we've had conversations with Aboriginal stakeholders about having that information easily accessible on a page. And I think that's where, kind of thinking about how do we, continue to do that. But also one of the exciting opportunities is that we are delivering evidence-based programs, and we are delivering locally developed programs here, and really thinking about how do we, the evaluations are underway of those. How do we get the evidence of those adaptations onto the menu, and how do we, what's the pathway for kind of building that understanding there? It is a journey, to do that, and we're also not, looking at, everything needs to have an RCT. That's just not feasible. But I think, in terms of when we're looking at decision making around what may work and the considerations, the menu helps to kind of provide a deeper picture, of that. So hopefully that kind of answers there's a place for all the evidence. This is one tool, and kind of we need to think about that broader range of tools and that broader ecosystem there as well.
And I mean, I'm sure there's sector organisations that are certainly already working in this space, and I'm sort of aware of and thinking about the menu programs that have been found to be really strong and evidence-based, but I'm right to think that most of those haven't had an Australian context, and it'd be interesting to consider who in Victoria is currently running those and whether they're building an Australian context around some of those programs already.
Well, I think, with the menu is that it was used to inform, in the commissioning of the family preservation unification of the evidence-based programs that were offered there. So we have used that, and we do know that there are agencies delivering the programs. And this also really reaffirms their decisions in terms of, the effective programs have been delivered, and we are aware that they are conducting evaluations of those. So I think that's the exciting piece to think about how we get that information on there. I'm really excited. If you are delivering an EBP, or you've got a program in development, please reach out and talk to us about what you're thinking about the local evaluation, and because it'd be interesting to think about that in the pipeline to get onto the menu at some point.
Yeah. I mean, in reviewing this material, did you actually find any sort of learning that jumped out at you in relation to sort of the data tools, the methodologies that were used across these types of programs? Because you never really get the opportunity to have that sort of deeper dive into consistent methodological practices either.
Well, you asked it. So Mandy has had a sneak peek of a little Power BI dashboard that we have pulled out. So this gets me really excited. So in the data extraction process, the University of Adelaide team, they were literally going through each paper and copying and pasting effect sizes, indicators and tools used. And we're using that really to assess, kind of the risk of bias in terms of sampling and design and reporting. But what it's actually meant is that we now have a really rich repository of information on evaluations. So, and I'm not going to show it today, but it is something I'd be really kind of interested if this was useful of the sector, is that we can actually now go in and say, I'm interested in parental self-efficacy. And we can click on a program and we can show you every program and study that's assessed parental self-efficacy. But we also have a list of all of the tools that they've used and the indicators of what they reported on. So that's really exciting. So, or you can start with saying, I'm interested in a certain tool like NICFAS, and you can click on NICFAS and we can show you every study that's used NICFAS as to evaluate. And we can tell you the tools where they've found an effect or not found an effect, or if it's been trialed with different cohorts that are relevant to interest. So that age-old question of how do I measure this, and what are the tools that are out there, is that we're starting to get a picture of each outcome and different ways to approach this. And I think this is really interesting in terms of kind of building our understanding of how different indicators are used, and particularly, what indicators and tools and measures may be validated for our cohorts and context, and maybe, things that we didn't really consider about. So I think there's that other side of the menu that we've kind of not really explored too much yet, but I think that would be great. If we're thinking about the submission pathway, for the menu is, like, do we need to kind of, when you're designing a program, here's how you're going to evaluate and measure it. And if you're not sure how, we can give you a list of tools that you may want to consider. And we've also, Pauline and I, have had so Pauline's on the course, she's the senior policy officer, did a lot of writing of the evidence summaries. For us, it's, we have this understanding of the evidence landscape now, but it's like, how do we improve and build on that? And how do we give guidance to researchers around, to reduce your risk of bias in the studies, you need to report on breakdowns by risk categories, and you need real information on the decision making in terms of the design. And and I think that's one of the reflections has been is that there is a globally a wide evidence base out there, but actually a lot of it has been excluded due to risk of bias. And I think we have to really kind of think about what we can do to lift our capability, but also the capability and understanding of academia, to make sure we're actually getting high quality outputs that we can use there. And so I think there's a lot of different discourse and dialogue we can have. And again, with some of the programs, when we really drill down, are the outcomes that a program is effective for relevant to our service system and decision making? A lot of, we see a lot of nutritional outcomes and, the effect size, positive effect sizes for certain, things. But when we're thinking about child protection system contact and, I think that's where the menu helps in terms of the maturity around asking questions, not necessarily giving you all of the answers, but actually kind of progressing that there as well. So.
Thank you, Stephen. That was, I'm just really excited about also the potential of that evidence base about the process that you've developed, because I can see that being hugely important. And I mean, also exactly the comments you're making about the role and the relationship between researchers in the sector and research to practice and practice to research, and both engaging in partnerships that are really productive and valuable to each and meet each's needs, I think is really a great area that I'd like to do a bit more from an open perspective work in. So if people are interested in starting to think about those research sector partnerships, or have some, but perhaps they might not be tracking quite the way they want to track. I mean, there might be opportunities there to try and get a sort of a common clarity and common ground a bit more around some of these things. And the menu will be really important to drive that, I think. This has been an amazing session, really interesting, and it's just such a rich, it's a bit like an onion, it appears. Every time I hear you speak about this, Stephen, I hear slightly different information, not inconsistent, just drilling down a bit deeper and a bit deeper, and providing some really great thought-provoking ideas, because really it's about not just the product itself or its purpose, it's actually about creating an appetite for different types of evidence, the value of evidence, and all pulling that together so we have a good understanding across the sector. Would anyone else like to make any comments? I'm particularly interested in whether people here have looked at the menu, and if you would be willing to come on board and just make any reflection on how you found it, or put comment in the chat. Because we're actually 1 minute over now, but it takes a little bit of processing, I think, too. So I think it will be a journey.
Well, you don't have to answer now, but I know, like, not to kind of look at the vanity metrics, but we've had over 37,000 views, which just blows my mind at the level of and really high rates of repeat users, which, you know, is reaffirming in terms of the gap. But I also, you know, kind of, where do we take it from here? And you know, I think at the end, you know, we've developed this for you. It's not, you know, and it's a public resource. So, you know, really guided by, you know, any feedback that you have and ideas, because there's lots of different ways that we can take this and really complementary to the work that you're all doing. And I think that's where, you know, kind of we're kind of on this journey together, and you know, committed to this. So
yeah, absolutely. Oh, thank you very much. We better wind up because people have very busy calendars these days. Thank you very much, Stephen, and of course Jane, who I think had to rush off, as most senior execs do. It was a really interesting session, and hopefully this will be just a very first start of what will be an ongoing conversation. Certainly, Stephen, and the details to connect with the menu are in the chat, and both, hopefully, you'll also want to reach out to us to talk about your evidence needs, what your thoughts are about where the value for this type of process, or more broadly, your evidence journey is. And we're really happy to have those type of conversations. Feel free to join our mailing list, because that's a way of keeping up in touch with all our new information and new opportunities. And they'll include the menu, but I imagine the menu will probably move towards having their own mailing list with their 37,000 people who have connected with you, Stephen. Thank you so much, and we'd love to hear from any of you, and I hope you enjoyed the session.